Um, okay, so I'm going to talk a little bit about the issue of engaging clinicians in uh, learning systems. And this is a little bit more in the weeds than the sort of larger system view that Pete was just talking about. And I want to start off by just showing our definition of engagement. That we hope applies to all the different participants in the learning health system. And the definition includes being part of a system that's producing information, knowledge, and know-how application that not only results in improvements in your own health, but also in the entire health system. This means, to us, engagement means involvement in participating in all phases of knowledge development and research, informing the questions, doing the work in getting learning to happen, and then applying the results. So engagement, this session I'm finding we're talking a lot about systems. It involves systems and processes to make that happen. And this slide represents the logic that we use behind the approach. And these are the principles or drivers of engagement that we've used across scores of projects and hundreds of very large numbers of clinicians and care teams. So the processes are meant to support effective leadership, to build a sense of shared responsibility for improving outcomes, the use of transparent measurement and data sharing, engaging everybody in the system, patients, clinicians, researchers, enabling people to participate in continuous learning, and the effective resources like tools and training and support that are required to participate in the policies and tools to reduce the transactional barriers. So I'm actually going to just focus on the first couple of drivers. When James was talking yesterday about building infrastructure, those are many of the remaining drivers. And I decided to use an example that illustrates what's become a standardized process actually for doing this to get the conversation going about with clinicians. And this piece of the process is analogous to Eric and Sarah's input into the learning health system on their slide that they showed yesterday. It's the part about understanding the internal and external environment and identifying problems and innovative solutions. And the example I'm using is from Joyce Lee. She's a pediatric endocrinologist at the University of Michigan. And she's also a leader in the Type 1 Diabetes Exchange, which is a network of about 75 endocrinology practices, about 50 pediatric and about 25 adult, that focus on improving care, that focus on research for patients with type 1 diabetes. And so these are slides that she put together using our standardized process. So, and I just want to present it so that you kind of get a feel for what this is like. So we all know that in 1993, the DCC trial showed that intensive therapy effectively delays the onset and slows the progression of diabetic retinopathy, nephropathy, and neuropathy in patients with diabetes. The trial showed that glycemic control matters and that we as clinicians can help our patients prevent or delay the complications of type 1 diabetes. That was 20 years ago. Today, in the Type 1 Diabetes Exchange, these are data showing the percentage of patients by age group whose hemoglobin A1C are meeting target. And you can see there's a wide variation in the performances and all that red hot. This slide shows the variations, a funnel plot showing the percentage of patients at each of the 50 pediatric clinics who meet the A1C goals. And you can see that there are some sites that are performing above control limits and, some sites that are lower performing. And so when we show data like this to clinicians, they have kind of a predictable reaction. It's like this. And then they say things like this: the data are wrong. my patients are a lot sicker than those patients, and it can't be true because we're working really hard, and we're the top people in the country, and we really care about this. And so once people have their reaction, then we can go on to talking about the really important parts of this, which are, well, what is explaining the variation between the top performing practices and the lower performing practices? And maybe there's some things we could learn from the people at the top. And then what about this gap? The gap between how we're doing on average and where we want to be. And so the goal is to actually engage everybody in a conversation about working on the important problems and figuring out where we should be applying our systems improvement activities and where we should be applying our research activities. And this kind of conversation with this presentation gets to that point pretty fast. Usually within a few hours, you can be having a very meaningful conversation about this. And so yesterday, we were talking about the things that cause people and motivate people to get involved in making improvements and moving outcomes. And we were talking some about the extrinsic motivators, things like money and recognition and reputation and career options and employment and being part of a network like the Type 1 Diabetes Exchange, where you can write grants and get your research funded. But there are also really important intrinsic motivations that this model is meant to tap into, which we think are probably more important than the extrinsic motivation, the common purpose, the sense of mastery, commitment to continuous improvement and learning, the sense of trust and friendship and solidarity that gets built up in a network that sort of drives ongoing participation. And so hopefully when this process works, when this works, there are processes for how we focus on outcome, how we learn from the data, from the gaps in outcomes and from the variation, how we enable a discussion that creates a sense of urgency and a culture of learning while making it possible, reducing the fear and anxiety that we all experience when we see that our performance isn't where we want it to be. And then the processes that reduce the challenges of participating and provide the kinds of tools and training, the really useful support that we need in order to be part of this. When it works, it produces a culture like this where we're all working together and as we say in many of our networks, stealing shamelessly and sharing seamlessly.